So previously, when asked about targeted treatments for children with Fragile X, you recommended antioxidants and low doses of sertraline, among a lot of other things. Is that still the case?
Well, yeah, those antioxidants I recommend for all, just because we know there's oxidative stress, not only in those with Fragile X syndrome, but also pre-mutation carriers. And I think antioxidants are very helpful to counteract that oxidative stress and to help with some mitochondrial dysfunction. We did a controlled trial of low-dose sertraline. By low dose, I mean between 2.5 and 5 milligrams of sertraline in young children between the ages of 2 and 6. And we found it very helpful for development. It improved both visual spatial abilities and fine motor abilities. But for those with Fragile X together with autism, which represents about 60% of those with Fragile X syndrome, it was particularly helpful for expressive language abilities. So I think it can help overall development, visual, spatial, and language development. And it also can help with anxiety. Anxiety is a problem through all ages of individuals with Fragile X, males and females. And so sertraline or another SSRI or selective serotonin reuptake inhibitors such as fluoxetine, which is Prozac, or citalopram. There's many SSRIs that are anti-anxiety agents, and I think those are particularly helpful.
So it would be a trial and error situation?
Yeah, you can try different doses and different types of anti-anxiety medications. But there are other new targeted treatments. I'm particularly enthusiastic about metformin. Yeah, metformin is a type 2 diabetes medication. It also helps individuals lose weight. So it's been used in adults and children. However, in the animal models of Fragile X, it can cure or dramatically improve the features of Fragile X. In both the Drosophila model and the knockout mouse model for Fragile X, it alleviates the Fragile X features. And we've seen very nice effects in children and adults with Fragile X syndrome treated with metformin. And we're now carrying out a controlled trial for individuals ages 6 through 25 so that we have actual evidence for improvement in language and cognition and behavior. We don't have the results of that controlled trial, but when we use metformin anecdotally, it's been very helpful for the vast majority.
And is that available in Australia?
Absolutely. It is a medication that not only helps with type 2 diabetes, it lowers blood sugar, it improves high blood pressure. It's used as a treatment for polycystic ovarian disease in women, even preeclampsia in women, gestational diabetes, but it is also protective against many forms of cancer, including breast cancer, uterine cancer, cervical cancer, ovarian cancer, and many of the cancers that males suffer from. So it is a great drug. It's often called the aspirin of the 21st century for the general population, but it is also a targeted treatment for Fragile X syndrome. And we've seen improvements in language and behavior and also weight loss. Many individuals with Fragile X syndrome are overweight, and so metformin can lower that. The key to using metformin for treatment is to start at a low dose and go up slowly. So you start in an older child or adolescent, you start at 500 milligrams at dinner, and then a week later you would take 500 milligrams at breakfast and at dinner. And that dose is a general pediatric dose, 500 milligrams twice a day, but the adult dose is 1,000 milligrams twice a day. So you would go up higher, so it would be 2 tablets at breakfast and 2 tablets at dinner.
We see a lot of information and news about treatments such as gene editing called CRISPR. What are your thoughts on what is on the horizon for treatments in the Fragile X?
So that is on the horizon. CRISPR is a gene editing tool, and so the thought is you could cut out the CGG excess repeats for both pre-mutation carriers and full mutation individuals with Fragile X syndrome, and then do that in cells derived from the patient, and then reintroduce those cells back to the patient. But that will take several years before that is a viable treatment for Fragile X syndrome, but that is a treatment of the future.